Once upon a time, there was a young, innocent, and gullible boy who believed in a world with love and no hate. A world where people who gave more than they took. A world where the good guy always beat the bad guy. A total utopia where there was enough money and resources to go around for everyone. That boy grew up in a middle-class home, living paycheck to paycheck. Do you recognize that boy? The one habit my parents ingrained into me growing up, despite my modest upbringing, was that we were blessed and that it was our responsibility to give back to those who were underprivileged. My parents particularly worked very closely with the orphanages, and each summer, growing up as a child, I would visit India and I'd watch my parents mentor these young orphans, and always left with a feeling of awe and gratitude for what I had. I remember this one moment when I was young. My parents took me to India one summer, and we walked into this orphanage just outside of New Delhi. As soon as we entered the gate, on that beautiful, slightly breezy day, several kids with smiles from ear to ear would come rushing in to my parents and hugging them and kissing them and saying, "Hi mom, hi dad, we miss you, we love you." And I remember that feeling. And then I remember someone tapping me on my shoulder. And it was like a young female who was 7 years old, and she had these strikingly beautiful green eyes, saying, "Hi, Nikhil Bhaiya," which is brother in Hindi. I remember that moment and my dad turning to me, I'll never forget this, and saying, "Nikhil, this is what I want my legacy to be when I pass away. Helping others, helping these orphans. What's your legacy gonna be?" I realized then that I wanted to help those who were suffering, and that inspired me to become a physician. As soon as I finished my training though, the unthinkable happened. My mom suddenly fell ill and was diagnosed with terminal ovarian cancer. And just a few months later, she passed away. My world changed. But during that period, I realized the doctors who were taking care of my mom were very detached and robotic in nature. And in that moment, I decided to develop personal bonds with my patient population and began concentrating on the liver failure population and their issues with addiction and obesity. This population suffered from emotional, physical, and spiritual traumas, and they needed someone they could trust to open up to, someone they could trust with their life. During my many years with that population, we saved thousands of lives as a team. And then COVID hit. The world was turned upside down. In the hospital setting, patients were dying daily. And those mostly affected with COVID and that were dying were that obese population. Something had to be done to prevent this population from dying and help improve their outcomes. So, me and two of my colleagues created a company and an app called YOLO. We wanted to target the childhood obesity and food insecurity issues, as these were early indicators for patients to later develop diabetes mellitus type 2 and cardiovascular disease, and liver failure. The app allowed you to donate healthy meals to underprivileged children each time you worked out. And we ended up donating a total of 1,000 meals and spread the message of healthy lifestyles to our youth. At the very same time, my own mental health became a huge issue. I was overextending myself, and my two partners decided to part ways with the company. And during that dark time period, I suffered through addiction myself and felt like my world was falling apart. I felt all alone, and all I wanted to do was to help people. But I realized at that moment, I needed to help myself first. I went to rehab, and by divine intervention, I was surrounded by numerous doctors and nurses and realized I wasn't on my own. I used that time to heal, to reintegrate myself into community, and to transform myself into authentically who I am, which is a loving, giving, and altruistic individual. From that experience, I wanted to provide hope to all those who have suffered in some manner and find a way for us to collectively heal. The best way to accomplish that was to practice self-realization and self-care. When we are more mindful and balanced, we can focus on doing good things for ourselves, like exercising, all while helping those who are underprivileged in a fun and unique way. Through my experiences, a new passion and mission came in the form of AlignUs. AlignUs will help transform and heal us from our traumas to prevent poor health outcomes. It will help create a connected community that embodies self-love, self-empowerment, and is nurturing for all human beings. I'm grateful for you all being here today, and thank you.